everyone, and welcome to this episode of WVU Medicine Children's Chats. I'm your host, Catherine Vey. Today's topic is pediatric immunizations and its importance for our kids' health. And joining us to talk about that is Dr. Jeff Lancaster, the Associate Chief Medical Officer of WVU Medicine Children's. Dr. Lancaster, welcome.
Thanks, Catherine. Appreciate you having me.
So before we get started, I want everybody who's listening to get to know you. Tell us a little bit about yourself and how you came to be part of the team here at WVU Medicine Children's.
All right. Well, I've been here a long time. Started here in residency in 2003. I was in med school here in 1999 to 2003 before that. So my clock starts either in 99 or 2003. I'm a pediatric hospitalist, which means I just take care of hospitalized children, babies and children. And then that's my clinical role. And then I have an administrative role. I'm the Associate Chief Medical Officer for Children's Hospital.
So I guess the adage that Amy Bush, our Chief Administrative Officer, likes to say is true. Once you're here, you can never leave.
Yeah, I would never leave even if they asked me to.
Well, that's good. We're happy you want to stay.
Yeah, I love it here.
Well, let's get into it. So shots, vaccines, immunizations, they're called a lot of things, but I guess the first thing to address is, what is it?
All right, so I'll say all vaccines are immunizations, but not all immunizations are vaccines. So an immunization is anything that prompts our immune system to make a response to it. So it's a very vague description. Vaccine is a bit more specific. So a vaccine is where a scientist can take what we call an antigen. An antigen is a structure on the outside of a virus or a bacteria. And I'll just say microbe to mean virus or bacteria. So it's an antigen, it's a protein, a lipid, or a sugar on the outside of that. When that is injected into our body, our immune system says that is not part of me. And what that does is it allows our immune system to create a response to fight it. And so the antigen needs to be recognizable by our body. So the next time we get exposed to this antigen, like a real infection, the immune response we've already made can start attacking. So the way I think about it in my head is that the antigen is like a face. So when we give, when I see someone, if I see their face, I'll probably recognize them again. So that a good antigen is very recognizable. If I see someone's arm and I only see their arm again, I'm probably not going to recognize who it is. And so that is how our immune systems work. They see something that they remember and says, this should not be here. And then we use antibodies or cell-mediated immunity to attack that and destroy it and protect us.
So how early as parents should you start thinking about these vaccines for your children?
We can start even before our children are born. So there's a vaccine against RSV that pregnant mothers can take, and that mom will make antibodies to RSV and share those antibodies with her baby. And those babies are protected through RSV season from mom's antibodies. If we don't have that opportunity, there are other vaccines that start right after the baby's born for hepatitis B, and then there's a regular schedule for the other vaccines, like for the strep pneumo bacteria, diphtheria, polio, tetanus, pertussis, all that stuff. It starts at about 2 months of age, and 4 months and 6 months, and just continues throughout childhood.
So say a parent doesn't start their child's vaccines right away at birth or when they're young. Is there a way they can, I guess, catch up, for lack of a better word? If you're a little bit off on timing or have a change of mind about your child's health, can you really start at any time and then your pediatrician will put you on a schedule? Yeah,
late is better than never. And there are recommended catch-up schedules through the CDC about how we get back on track.
So some of the terms that parents may hear when they take their kid to the pediatrician, a booster versus a vaccine, I guess, sort of what's the differentiating factor there?
Yeah, so the way I think about this is our immune systems are like our memories. So the longer ago that I've learned something, the more likely it is going to be difficult for me to recall it later in life. So our immune systems, for some vaccines, the farther back we've been vaccinated, our antibody response or immunity to whatever has kind of starts falling off. And there's been no reminders in that time to our immune system, like we haven't got the infection or something else. So you can get a booster, which kind of prompts our immune system to say, oh yeah, this is the the virus I need to protect from, and it's the same vaccine again, and our immune system quickly recognizes it and starts making antibodies again.
So is that different? People might get a booster, but then every year we have to get a new flu shot. Like, how is that different than a booster?
Flu shots are a little bit different. The flu virus is fairly similar from year to year, but it has different antigens on the outside. So a flu virus, immunity to one flu virus does not mean you'll have immunity to the next one. So, and the flu virus changes from year to year just based on kind of what happens in animals in a certain part of the world. And then by the time it gets here, our scientists try to predict what's going to be the predominating strain that goes across. Typically they're right, but not always.
We know that there is a little bit of vaccine hesitancy out there. Our providers like you see it not only here in the hospital, but in our clinics. Yep. What's sort of the main reason that you hear about that parents are hesitant to vaccinate their children?
I think, all parents care about their children, and we value them above pretty much anything else. And so we are stuck with trying to make the right decisions for our family and our children. And that's not just limited to vaccines, whether or not you play football or go on a date or go swimming on a lake. So there are all kinds of risk benefits that we kind of weigh as parents. And so from a vaccine standpoint, things were going pretty well, and then COVID happened, right? And I think it introduced a lot of skepticism and doubt and reexamining of, vaccines and are they important? Are they helpful? Vaccines are a little bit of they were so effective that they made us forget about the horrible diseases that they cause. I was watching Poldark on British Broadcasting. So it's a great show, and it's about a British soldier who lost the Revolutionary War, went back home to England, started making his life there. He had a young family, and then his daughter got sick. The doctor came in and said, it's the putrid throat, and I've been a doctor for 20 years. I'm like, what is the putrid throat? And they show a picture, and this little baby has these yellow pseudomembranes, which would cue for me. It's like, oh, that's diphtheria. And so it's my first real exposure to diphtheria, because we have had 0 cases in the United States since 1997. In the 20s and 30s, it was one of the leading causes of illness and death in children. Vaccine came out in 1940. A decade later, cases have been very low to non-existent. So the effectiveness of our vaccines have made us forget about these diseases. One of the issues is that even though we don't see them here, they're not gone. In evolving in countries that are still developing, diphtheria is still endemic. So the tact I use to talk to people is hey, just because we don't see them doesn't mean that they're not here. These are the same vaccines that we got as children and our children got, and have really made us, our culture, our country, as healthy and as successful as it is.
And is it kind of like if we don't keep getting those vaccines, it might come back?
Absolutely, because the world is more interconnected now than it ever has been. And we have wonderful people who come from countries who have these diseases that are still causing problems. And if we do not, there's this term called herd immunity, right? And you need about, we'll say out of 100 people, you need about 95 people in that group to be immunized to have herd immunity. And so what that means is if you have these 100 people and one person has a disease, if 95% of that group is immunized, it is very hard for that disease to pass through this community. If you have less than 95%, say 80%, 85%, then there's a whole lot more targets that virus can jump to and cause more disease. And what we're always trying to do, we want to protect everyone, particularly the kids who have immune disease like cancer or immune deficiency, who cannot get these shots, who can't take it, because if they get these infections, they're going to get very ill.
So it's not always just about protecting yourself too. And that's, I think, something we saw during COVID-19 too. You talk about these vulnerable groups, not just children, but you think about the elderly with certain things and other immunocompromised, even adults. if we're not protecting ourselves, we're also not protecting others.
Yeah, that is a huge part. So every time we get a vaccine, especially in the childhood vaccines, we are doing something for ourselves, yes, but we are also doing something for someone else. It is a selfless act to do this because, the chances, so if someone doesn't get a vaccine, the chances of that child getting ill are still pretty low in the United States until the next child doesn't, the next and the next. And then we're just inviting to lose a fight we've already won.
So let's talk about some of the, I guess, more of the common misconceptions or questions that people ask. Sometimes we hear people say, oh, vaccines aren't safe. Is that true?
So vaccines, to become a vaccine, there has been rigorous testing, safety testing. And once you become a vaccine and you're on the schedule, you are continually tested and monitored. Vaccines are safe, and again, weighing risks and benefits. Vaccines are magnitudes of orders safer than the diseases they prevent. And that is hard. That can be hard to conceptualize because for most people, they're never going to see these diseases. And so I can understand that line of thinking. But if we do not keep strong vaccination rates going, we will see these diseases again.
Another one you sometimes hear, vaccines cause autism.
Yeah, I can just say no and leave it at that. But I'll go through a little discussion about it. Autism is awful, right? And we're seeing it more and more, and it's hard and it's heartbreaking for families. Something causes it, and we don't know exactly what. We've tried to blame vaccines for autism for 20 years. And there was one study in England that was very flawed and has since been retracted. And that really started the vaccine and autism thing. Since that time, hundreds of big studies have come back over and over and over again showing no association between vaccines and autism. And even the vaccines before that contained thimerosal, the mercury, the one that could be metabolized into mercury, those were also not associated with autism.
Another one sometimes you'll hear is getting this vaccine will make my child sick.
That can be true to an extent. So anytime and I'll say the child's not going to be sick, your child's going to get a low-grade fever and not feel well. So anytime we stimulate the immune system, which is the intention of a vaccine, our immune system gets flared up and we don't feel good. We can get low-grade fevers, we can get achy, flu-like symptoms, things like that. But that's pretty mild and resolves with a day or two of Tylenol or ibuprofen.
That's me every year with the flu shot.
Yeah, same.
It's not fun, but maybe, not maybe, definitely better than getting the flu.
Having had the flu a couple times over the last few years, it's awful.
So speaking of that, sometimes you'll have cases where, a child will get the flu shot and maybe still get the flu. That doesn't mean that the vaccine's ineffective, correct?
That does not mean that. And so there are a couple reasons why a flu vaccine would not work. I mentioned earlier that the circulating flu viruses, there's not a guarantee that the scientists will say that's the one that's going to emerge and cause disease. So there can be misses. But even if there's a miss, there is some protection still from this year's vaccine or last year's vaccine that might be lingering around in your immune system to help protect you. But even if we do get the exact flu strain right and protect against it, all immune systems are a little bit different. Like my response to an immune to a shot is different than yours, right? So if you make this really robust antibody response to the flu vaccine, you may not get any symptoms. If I make a so-so response and I get exposed to the flu, I will have some protection still. So, my fever won't be as high, my congestion won't be as high, my risk of pneumonia will be less than. So there is still benefit. Even if you get the infection, it should be milder.
I singled out the flu shot, but I want to know for, my own knowledge, I have kids. And I guess parents at home will want to know, even though I singled out the flu shot, if somebody gets a different type of vaccine, can you still get whatever that disease is and it lessens the symptoms, or does it really depend on the vaccine?
It depends on the vaccine, but for the most part, the especially the recommended school age vaccines are highly effective. So, and I think we can just think about this way: when's the last time you've known anyone to get polio? Right, polio is gone, and my mom's best friend had polio. This was in the 50s, and she had neurologic kind of symptoms the rest of her life. And so that tells me that, the poliovirus vaccine is very effective. Pertussis we still see on occasion, but we saw a whole lot more before the pertussis vaccine came out. Hepatitis B is something that if you get that as a baby, which the transmission time as a baby happens if a mom has hepatitis B infection, those are infections that are chronic hepatitis that affects that person for their whole lives. I've not seen hepatitis B in my whole career because we've immunized against it. And so by a overwhelming margin, these vaccines are like super effective.
We're in the season now. We mentioned the flu. We mentioned RSV. 'Tis the season. It's not a good season. It's scary for parents. It worries us here at WVU Medicine Children's. But for those of people listening who don't know what RSV is, what is it? Explain it to people. Why is it so dangerous?
RSV stands for respiratory syncytial virus, and it is the most common cause of hospitalization and illness in children. So children's hospitals are filled with kids with RSV every year, and we typically have an RSV season. And for us in this part, the mid-Atlantic area of the country, ours usually starts in October-ish, sometimes November, and then runs through spring. So end of March, end of April usually is where we see it. So what it does, it causes upper respiratory and lower respiratory tract infections. And children 0 to 2 are at the highest risk. And then even at higher risk are kids with chronic like heart disease, lung disease, things like that. And so when RSV infection happens, it causes tons of mucus and snot. And so, parents who have had kids with RSV, they just know how much nasal suctioning and drainage happens. And so you get upper airway symptoms, but lower airway stuff is what get kids in the hospital. So the way the airway is shaped, you have the main breathing tube that comes down, and then it branches off into two big tubes, and then branches and branches and branches again to the smallest tube called bronchioles. These little bronchioles are tiny, and they lead to the air sacs. They get so cluttered up with mucus and inflammatory cells that you just can't move air through it very well. So one of the things babies do to help that is to try to push it out, and they do that by coughing. And so cough is a huge part of RSV. So to protect it, what do we do for RSV? One of the most frustrating things is, you might say, hey, Jeff, this is the most common cause of hospitalization of kids in the world. Why don't you have something better to treat it? And we've been asking that question for a long time because we don't have a medicine that fixes it. And so what we do is supportive care. Nasal suctioning, because babies prefer to breathe through their nose, controlling temperature, giving them oxygen if they need extra oxygen, and maintaining hydration. So making sure they're hydrated, because all of the fevers you get and all the breathing fast, you lose a lot of fluids that way. Short of that, if prevention is the best thing for RSV. And prevention can be as basic as, if you have a newborn baby, don't go to Walmart in the first month or two of life.
They say everybody puts those signs on, the baby carriers if you have to take them out, like tiny babies can't handle germs or something like that. It keeps people from coming and touching the baby. Absolutely.
And it's Walmart is almost as busy as Mountaineer Field on a fall Saturday. So avoid Walmart if you can. But hand washing, right? After every cough or sneeze, make sure you do it into a tissue, throw that tissue away, and then hand sanitize. Some people will say, coughing or sneeze into your elbow, which typically is good advice. But remember, if you're going to be holding a baby where that baby's head goes, it usually goes right into the crease of your elbow. So, just if you can keep a tissue on hand and then discard of it when you're done. From a prevention standpoint, there are ways to immunize a baby to help them get through their RSV season. So the first thing was the vaccine for moms that they need to get 4 weeks before the baby comes out. If we didn't get that opportunity, there is another injection of antibodies. So nirsevimab, or Beyfortus is the trade name, is it's what's called a monoclonal antibody. So I talked about the antibodies we make when we get an immunization. These are antibodies made in a lab that are directed specifically against the RSV virus particle. So it attaches to this fusion antigen on there, and it keeps the RSV particle from entering our cells and replicating. And so we give that to babies, and it can be right after they're born, and it lasts the whole RSV season, and it protects them. Now, your baby can still get RSV after having that. The big benefit is it decreases the severity. And so the studies for this show that decreased medically attended RSV, which means you don't have to go to the doctor as much, or you don't get hospitalized as much.
So that could be the difference between the parent being able to treat baby at home versus having to come see us here.
Absolutely. And our goal, RSV is a big part of the hospital and what we do. Our goal would be, we are so good at this that in RSV season, we have 20 open beds and we're just looking at each other, because then we have done a good job. Our mission it should be to never have to admit a child to this hospital.
What is the differentiating factor between a parent's at home, their kid's sick, don't know how severe it is? At what point as a parent do you sound the alarm, call the pediatrician, come to the emergency department? What do we look for that becomes concerning? Because if, it could get to the point where you're so worried. I know as a mom, every time my kid gets sick during that season, I'm like, okay, we got to monitor him. So what advice would you give to parents? Like, when do we sound the alarm? When do we panic?
Yep. So I think first, moms and dads should trust their gut instinct. You know your baby. If something's not right, never hesitate to reach out and talk to somebody. That is our job as doctors, to answer questions from concerned parents, and then help them make the decision of what's the right thing to do or the next necessary thing to do. And so some tips we tell parents, especially during RSV season, from a respiratory standpoint. If you see your baby like working hard to breathe, and I'm moving up and down because as I breathe in, I'm trying to expand my chest, and it makes me taller. And so babies will do that. They'll do that and they'll bob their head. So head bobbing and retractions. As they breathe in, you see little dents between their ribs or under their ribs. It's called retractions. You can see some retractions above the breastbone. We call that tracheal tugging. So you can see that. You can see working really quickly to breathe or breathing faster than normal. Babies who are sick and not doing well don't want to eat. And so if they are just refusing to eat, if they're getting dehydrated, not making as many wet diapers, all of those things should make a parent feel like, I think I might take this baby into the doctor or the emergency room, whatever you have access to.
And then that's when you guys take over, right? And start doing your best for that baby.
We will be there and we'll take care of that baby.
And like you said, it's kind of like, I've heard, a lot of our doctors say it here, like, we're there when you need us, but we hope you never do. I feel like that's never more true than during RSV season. Absolutely.
And it'll happen. RSV is as effective as the treatments are. Nothing's perfect yet. And so we will still be needed because we're serving a great big area, this state and the regions around it. But our goal is to always be able to take the sickest kid that needs help anywhere. Certainly if they're here in northern West Virginia, but if they're anywhere in this state, or when we moved over into this hospital, we moved in September 2022, and it coincided with the worst RSV season any of us have seen. It was really bad that year, and we were getting full with sick kids here, but the hospitals in the states surrounding us were completely full and had no space. We started receiving transfer calls from hospitals a couple hundred miles away, which we've never heard from before. And so I think that is the benefit in these RSV treatments or kind of immunizations, is that they can help decrease the moderate illness that some kids get that have to come into the hospital, to where they don't have to be in the hospital at all. That way we can always take care of the sickest ones. Doesn't matter where they are. We just want to fix kids and make them better.
We've talked about a lot of things during this episode, and obviously there's a lot of information when it comes to vaccines. If you had a parent in front of you who was on the fence or thinking about vaccinating their children, what would you say to them? Like, what's the biggest reason you would give them to vaccinate their kids?
Yeah. So I would stress, one, the safety and effectiveness of vaccines. Short of having them watch that episode of Pull Dark with me, I would let them know that the diseases that we prevent are absolutely real, and they're absolutely still around. We've seen that with measles. West Virginia still has fairly good vaccine coverage for children entering school, and we have not seen measles yet this year because of that. And so I think every time a parent makes a decision to not vaccinate a child who could be vaccinated, it's one more brick taken out of the wall. And it really puts other kids in jeopardy as well, especially those who are most susceptible to severe infections. And so, I don't want anybody to feel guilty, and I respect everyone's thoughts and opinions, but that's the thing that I want people to know. Is that we are preventing something really, really bad and using something very safe and very effective.
And also, too, if parents are on the fence, ask your pediatrician.
Absolutely.
That's why our team is here. They'll answer all the questions and help parents make that best decision for their kids. So, parenting is tough. They always say it takes a village. So include your pediatrician in that village, right?
Yeah. And I'll be honest with you. I've been a pediatrician a long time. I ask my kids' pediatricians questions, and it's because it's always nice to have other perspectives. And so certainly pediatricians are the most qualified people in the world to talk to you about your vaccinations and your children.
Well, Dr. Lancaster, thanks for being here with us and for helping us, open that conversation a little bit for parents.
Hey, thank you, Catherine. This was fun.
And thank you to all of you for joining us for this episode of WVU Medicine Children's Chats. If you would like to learn more about immunizations for your child or schedule an appointment with a provider, you can always go to WVUkids.com. I'm Catherine Vey. Thanks so much for joining us, and we'll see you next time.